this is the most transformational entitlement reform in 52 years. Big changes to Medicaid, which will make the Medicaid program much more sustainable. And instead of being a Washington-centered, Washington-focused program, this is going to give huge flexibility to the states to customize Medicaid programs for their own vulnerable populations. And we think to the benefit of those low-income, vulnerable Americans. Traditional Medicaid population is discriminated against under the Affordable Care Act because in the expansion states, the federal government reimburses Kentucky, for example, at 100% down to 90% for the expansion population, but only reimburses the traditional Medicaid population based on what's called the FMAP formula, which in Kentucky is about a 70% federal state cost share. So we think it makes sense to do what we're doing in the American Health Care Act, which is to eventually, by 2023, merge the expansion population reimbursement with the traditional population reimbursement and allow governors, like this one, Governor Bevin, who's requested more state flexibility to customize and innovate on Medicaid. And it's not a mother may I approach. We don't require the states to come beg the federal government for a waiver. We simply allow a per capita allotment or a pure block grant to the states to custom tailor their Medicaid programs so that they can target those scarce resources to the truly vulnerable people in our state. People below the poverty line, people who have high risk, people who are disabled, and people who are dual eligible elderly people.
Now let's talk about pre-existing conditions. There's been a lot of talk about that, especially with repeal of the Affordable Care Act. That was one of the main sticking points. So what does this do for pre-existing conditions?
Well, actually, it doesn't change the default federal law at all. It maintains guaranteed issue as a requirement, meaning that whoever you are, no matter what chronic illness or disease or pre-existing condition you have, you must be issued coverage. We also say the dependents can stay on their parents' plan until 26, which is a very popular provision. We also limit lifetime caps. So all of those features remain federal law. What changes is the right of states to apply for a waiver on the medical underwriting piece, the idea that insurers can charge more based on your health status. And also essential health benefits. We allow states to apply for a waiver to opt out of the federally mandated essential health benefits as part of Obamacare. But as a condition to get a waiver, we require states to take care of those people with pre-existing conditions, whether it's MS or cancer or a kidney disease or arthritis, whatever, diabetes, which is a big deal in Kentucky, whatever that pre-existing condition is, if you want a waiver, if you want to expose people to medical underwriting, you have to be able to take care of them. So what do we say? For waiver states that get a waiver, you have to protect people who maintain continuous coverage. So if you are a person with pre-existing conditions or develop cancer or diagnosed with a chronic disease, as long as you've maintained continuous coverage, you are protected against medical underwriting, meaning you cannot be charged more for your health status. There will be people, we think, a fraction of a fraction of a fraction of the population who will be in a waiver state, who will have not maintained continuous coverage, who will have a gap in coverage, who will be vulnerable. We want to take care of those people too, and so we provide multiple layers of protection for those folks by funding $130 billion in what's called the State and Patient Stability Fund, so that states can set up an invisible reinsurance program, meaning that the patient with cancer that is uninsured can go get a health plan. It will be priced very high, but then the insurance company will be able to keep that premium down for that patient because that insurance company will be able to offload that risk to the taxpayer through this back-ended reinsurance program.
Now, this is the second time that we've gone through an ACA repeal type of act now. And this is, it didn't go through the first time. So, and it was a tight vote this time. What made it so you were comfortable voting yes on this? bill?
I was comfortable because not only is this about keeping our promises, I've consistently said that I'm hearing the concerns of my constituents who are asking me to repeal this broken law. And I think Obamacare the Affordable Care Act is a broken law and it can't be fixed. But I think health care can be fixed. And I just hear too many stories from a father that I heard from the week before the vote who said, he got his premium increased to $2,000 a month. He's a family of 5, 3 kids, one with a chronic disease. And he begged me to fix the law. And so many middle-income Americans who don't get their health care through their work and don't get their health care through the government, they are in a real distress right now. And so the existing law, the Affordable Care Act, Obamacare, what's happening is it's in a death spiral. Premiums are skyrocketing, year-over-year premium increases of 25% or more, and people are losing choices. In 50% of the counties in Kentucky, families only have one choice. That means they have no choice. And just last week in Iowa, 94 out of the 99 counties in Iowa, no choices at all. Insurance companies are pulling out of the exchange. Our own headquartered health insurance company right here in Louisville announced that it was pulling out of the Kentucky exchange because it was no longer economically viable to participate. So we don't have a choice. This is a rescue mission of the American healthcare system, and that's why we're taking action. And it's a very difficult task that we've undertaken, but we really don't have a choice because we have to lower costs, we have to preserve choices, but we also have to protect people with pre-existing conditions. That's all very difficult to do, but we think we've struck the right balance.
Now, speaking of striking the right balance, the Senate has said they're probably going to make some changes, if not overhaul completely what you all have just passed. So what are your thoughts on that, and what do you think is the best way forward? What changes do you think they might make?
Well, that's the great thing about the Constitution. We have a bicameral Congress, and certainly the Senate has 100 very strong-willed individuals who have strong opinions about what is the right healthcare policy. No doubt the Senate will be making some changes. And then I think both the House and the Senate should vote to go to conference and iron out those differences. And hopefully we'll have the votes at the end to pass this bill to deliver relief for the American people and provide those multiple layers of protection for people who have chronic illnesses.
Now, is there anything about the bill that we have not covered that you think businesses need to know about that hasn't been getting coverage since it passed? Yeah,
I think one thing that a lot of people don't know, not just the business community, but the American people in general, is that this is just step one of a 3-phase process. The Affordable Care Act was passed through the normal legislative process and a reconciliation bill. They had 60 votes in the Senate to do a big part of this. The Republican Party only has 52 votes in the Senate. So in order to achieve all of what we want to achieve, we really need to go through 3 steps. Number one is this reconciliation bill, which only requires 51 votes in the Senate. The second step is a lot of regulatory changes by Secretary Price at HHS. Those are changes that can help rebuild a robust, competitive private health insurance marketplace. Changes to regulations, which can be easily done, reversing high-cost regulations that were enacted in the previous administration. And then bucket 3 or phase 3 are some bipartisan bills that can get 60 votes in the Senate and make further progress on bending the cost curve down. Things like repealing McCarran-Ferguson, interstate competition, association health plans, and medical liability reform to prevent defensive medicine.